Good evening, everyone. Everyone in the audience and the virtual and here knows who I am, so I won't go into the details. This was just something I just decided to do because in a regular clinic every day, like yesterday, among all the patients we saw, including with our fellow Dr. Alrubai, almost 50% of them I had to add on the supplements they were on. And some were repetitive and some were new, and some I had to Google later. So this has become a sort of a constant, steady mostly post-pandemic, we are seeing a lot more of it. Everybody wants to stay healthy or, resolve symptoms without getting something with a prescription because in their mind, prescription means side effects. Supplements means no side effects. So how expensive it is. And as I'll show you, some of them are quite expensive and the cost is enormous. So this was just many of the studies that I'm sharing, not too many of them. Of course, many of them are just meta-analysis and systemic reviews, so not very strong data and not in the mainstream endocrine journals. So this is something new for me, novel. So bear with me as we work through this. I'm learning as we sort of go through it. So it's more for us to be aware of this more than anything else. So the objectives would be, as you all know, growing consumption of nutraceutical products among patients and dietary supplements, and also potential health impacts, anything positive or anything negative, whatever we could cover, because I realized after I gave the title to Kelly that 15 minutes is not enough time to go through the whole of endocrine system. So we are mostly focusing on maybe a couple of areas which patients usually bring up or I'm more interested in. So I'm thinking about like a few days ago, there was a very, very cute video that you all should watch. I didn't have time to mount the video, so I just got a picture of it. So I sort of felt this way when I was preparing for this talk the last few days. So our outline would be impact of the billion-dollar industry in healthcare and pipeline of approvals, how it works for prescription drugs versus non-prescription drugs, because it's unregulated, huge market. And like I mentioned earlier, going through a few areas, but mostly focused on cardiovascular health, weight, and diabetes. And like I mentioned, I don't know if you all saw this video. It's really cute. I encourage you all to see. It showed that in Antarctica just a few days ago, these young emperor penguins were, as the ice is breaking off, they're just leaping off from the 50-foot ice cliff into the Atlantic Ocean. So it was beautiful how they were like sort of stalling and shall I jump, shall I not, and then taking the leap and everyone follows through. So I thought it was a very neat sort of thing. So, and you all know when I give a talk, I usually dedicate the talk to groups or people or, this is for all our patients' health, for them to do well. And for us as providers, also take care of our health also. And I found this interesting because many of these are herbs and supplements. So you go back thousands of years, and many times you look at deities or gods of medicine in individual religions or mythology, and it's amazing. There were about 200 deities that I was able to find in the one of the areas in Google. And of course, the more prominent ones were the Greco-Roman son of Apollo, Asclepius. Sorry, it's a tongue twister. And if you note the staff he's carrying with the snake winding around is what we have in our, in medical school is our staff of the Caduceus staff. So, and then Lord Dhanvantri from Hindu religion. And then this is an Egyptian goddess of medicine who could do harm and also heal at the same time. And her name is, I think it is, I didn't get the name here, but the other god here is from the Chinese medicine, which many of our herbs and many of the studies are from the Southeast Asian area. And it's Bo Sheng Dadi. He has temples all over China, and this is actually an amulet with his engraving. And of course, Saint Luke painting Madonna and the baby Jesus. And Saint Luke is considered to be a healer among the apostles, the 12 apostles. So those are some of the gods from different areas. So what is the definition of nutraceuticals? So they're non-specific biological therapies that are intended to prevent cancerous processes, manage symptoms, and enhance overall health. What are dietary supplements? Any substance that can be considered as a food or part of food and provides medical or health benefits, including prevention and treatment of disease. So when you combine nutrient and pharmaceutical and combine it, it's the phrase of nutraceutical was coined years ago. And you could use them as food additives or supplements, and definitely very unregulated area. And it's a very key market also, as I mentioned earlier. And part of the reason that it is such a rising area is aging. We are all as a globe aging, and we have a much higher aging population than we did 100 years ago. And rising incidence of chronic diseases, at least we are diagnosing a lot more of them, and also more innovations and product developments and growing need for goods enhanced by nutrition, and also demand for functional beverages. Like people want to just drink a smoothie and just feel fine all day without having to do anything. So, so there's certainly a big demand, even among the Gen Z, all the way up to baby boomers and everybody. There is a great demand for this, and also personal care products, many of them, and definitely it rises the final cost of the product when it does come to the market. So Congress did define dietary supplements in their DSHEA supplement of 1994, and it's considered a dietary ingredient, and it's intended to supplement the diet. And it can be found in tablets, capsules, soft gels, gel caps, liquids, or powders. It can also be found as a bar, and as I mentioned earlier, functional beverage. And their foods, they come under the general umbrella of foods, not drugs, and many of them can be labeled as a dietary supplement. So it's a pretty loose sort of definition and easy for the market to allow a lot of different supplements. And the product types would be, sources would be vitamins, probiotics, sometimes minerals, prebiotics, and the distribution channels, specialty stores, supermarkets, hypermarkets, now Amazon for a lot of things, and conventional stores, drug stores, retail stores, and several other areas that our patients bring in, pay $300 and bring in a big bag of medication. So what is the impact in the healthcare cost? Well, this is the packaging company. Just mind you, this is just packaging. It's right now $4 billion in 22-23, and it's predicted in the next 8 years to, we are at 24 already, so 8 years to rise over $6.3 billion. And if that's the packaging, what's the overall cost? Well, the overall cost is this. Right now, we are at about close to 100 million in 23-24. And it's predicted by 2030 will be up to 560 million billions or more. So that is pretty much your global sort of in the budget or cost of this. So it certainly has a high impact on what we do on a regular basis and how we address this with our patients. And what are the different areas available, or what are the interests for patients? Many of them. Well, it's disease prevention and control many times. And some areas such as cancer, chemo, and radiotherapy. I know one of our attendees, Dr. Kotwal, was mentioning to me, emailed a couple of days ago about turmeric as being used and how successful it's been. So soy isoflavones, curcumin, that is turmeric, ginger, and genistein, there are some. And then cardiovascular disease is a growing area, antioxidants, which we have studied for years and years and years. Garlic, it's been known for several hundred years. Omega-3 fatty acids, peptides, amino acids, neurotransmitter precursors, and proteins, and also other for skin diseases, which again, with aging process, everybody wants to have better looking skin, better muscles, bones. So the skin and the sort of the outer area of the body rather than the internal cardiac and cancer and all that has also become very important. Bioactive polysaccharides, bioactive peptides, carotenoids, and botanical extracts. So those are some of the areas. Some herbs which have already shown some proven benefit, and we see them in wound care centers and several other areas being used, such as like ginger tablets or gastroparesis, they do use it. So it's supposed to be anti-emetic. We all know about it. Ginseng used all over the world. It's an adaptogen in a way, looking at the hypothalamic pituitary axis. And then green tea, garlic, antibacterial, antifungal, evening primrose oil for atopic eczema, and also many times menopausal symptoms. Aloe vera, which is commonly used everywhere for wound healing, anti-inflammatory agents. So we also need to keep in mind the negative aspects. What was in the news just a few days ago, I think 2 weeks ago, for Kobayashi, the Japanese company with using a certain Benikoji, which was the red mold that was being touted for cholesterol and also weight benefit. I think several patients died, and the pharmaceutical company is under investigation now. So those are some of the areas to be very cognizant about while we're doing this. Are there any guidelines available for endocrinology? As of now, we definitely don't have. There are some small studies here and there. And maybe in the guidelines in the end, like ADA, there's something about cinnamon. Or if you're looking at the bone guidelines, maybe some comments about vitamin K. But certainly no clear guidelines as to how you use them, what you tell the patient, what is the dosing. Nothing is available. The last time there was any guidelines was from 2003, which is almost 20 years ago, by Jeff Mechanic in ACE. Since then, we don't have much data. As for those of us who like to look at this and sort of know when the patient walks in the room, this FDA does have this NIH-funded website called the CARDS, Computer Access to Research on Dietary Supplements Database. Those of us interested, where you put in the supplement and put in some information, and you do get some sort of data on this, whatever is available. And when Congress and when the laws were made by FDA and the Federal Trade Commission to allow these supplements to enter US into the market, the recommendation made for the supplement manufacturers was to follow the CONSORT guidelines, which is complementary and integrative health standards, health standards, consolidated standards of reporting trials guidelines. But as you would see, as we discuss, not all these supplements have had very tightly evaluated guidelines. So this is just an infographic comparing FDA requirements for prescription versus dietary supplements. Well, for FDA-approved drugs, such as those we have in the market, whether it's weight loss drugs or cardiovascular anything, so you need preclinical animal studies with multiple species. And then there's the phase 1 studies, 20 to 80 healthy volunteers, determine safety, frequent side effects, pharmacokinetics, PK/PD. Phase 2, hundreds of patients, assess effectiveness, compare with placebo, different drug safety side effects. Phase 3, which is many of the studies that we participate in, thousands of patients, safety, effectiveness, and also different doses. And then at this point, the FDA's Drug Commission, CDER, evaluates the efficacy of the new drug before they can be sold. And phase 4 is post-marketing. Once it's been approved and out there, such as the cardiovascular outcomes or any other side effect or any other impact that it may have, and also ongoing safety monitoring after the drugs get into the market. This is for prescription drugs. Dietary supplements, preclinical studies, animal multiple species, study safety, not a requirement. Clinical studies, often just under 200 subjects to show efficacy and short-term side effects. And then the manufacturers inform FDA of the new supplement coming into market, and then it's into the market. That's it. So that's how different it is when we look at it. So we'll start looking at the first drug. And like I mentioned earlier, many of the drugs have an overlap both with weight and diabetes and cardiovascular, and some of them actually overlap into bones and reproduction. So we wanted to, I sort of wanted to put it out there because certainly I'm not going to address the same product several times. So we'll start off with obesity, which is the sort of when you look at your MyChart emails in Epic, 50% of your emails today will be about whether the drug is approved, is Zepbound, am I getting it? What is the prior auth process? What is the cost? If we cannot get this, can we get Wegovy, or can we try something different? So I thought this would be a priority. And this is Oprah. I don't have an old picture to compare, but this is Oprah. Many of you all know she's the most popular talk show host of the previous decades. And this is her when she got off I think, was it Jenny Craig? No, wait. She got off the big weight management company, and because she had sort of didn't mention the fact that she'd been taking a GLP-1. And then I think after that, she stepped off the board. However, she's amazing sort of a spokesperson for weight management because she struggled with it all her life. So it's a chronic disease, global impact these days. It's not even just United States. And it's a complex interplay of genetic, environmental, dietary, socioeconomic, behavioral factors. And this is in 22. And 10 years before that, in 2012, very few states were red. And now most of us are red. And 12 more states joined who weren't there 10 years ago. And the lowest was obesity is DC. I was surprised. I somehow thought it was Boston or California. I guess not. Then 41% West Virginia. So right in our area, in the same belt, and we are right here. So, the red area is over 35% of patients with obesity. So, and this data is from the behavioral risk factor surveillance, BRFSS area. So, and within the last 10 years or the last 3 years, the rise in adults over the age of 20, between 10 years ago and now, is about 40%. So almost 50% of the adults, or 40% or more, are obese. And then among children, 2 years to 19 years, about 20%, which these are all big numbers now compared to what it is. So of course, with limited availability of medical therapy and pharmacotherapy, and we all are struggling with that, trying to get refills for our patients for a certain dose of Wegovy or Ozempic or anything. So many patients turn to either compounded drugs or dietary supplements. And according to comply with the Dietary Act of 1994, which I mentioned earlier, they cannot claim that a supplement will cure, treat, but structure function claims are permitted. So they can say they have a potential impact on an organ body system, and thereby they imply a health benefit. So with that premises, certainly there's been a bunch of medications that have sort of touted to help with the weight management area. And this is a review from Obesity, which is Obesity Society's journal from about a couple of years ago, looking at all available products in the market, which are dietary or nutraceuticals, and how many studies have been done and how many have been significant. And acupuncture, calcium, vitamin D, cocoa products, chromium, ephedra, caffeine, Garcinia, green tea, guar gum, conjugated linolenic acid, mind body, which is like Noom-like sort of thing, and phenylpropolamine pyruvate. There's still 100 more products, but these were the ones that were reviewed. And among the significant sort of studies, as you can see, there were very few of them. And even in those, they were very short term. The number of subjects were very small, not a big number of patients. And also, many of them did not go to look at side effects beyond the 2-month period or 8-week period or 12-week period. So that was a big issue related to this problem with this. And as I mentioned earlier, comparison for FDA guidance, for prescription, we have to have more than a 1-year trial duration, whereas for non-prescription, there's no such thing. A few weeks to less than 6 months is all that's needed. The smallest study I saw was 2 to 3 weeks. So that's how it's been. So moving on to the first one, which is the most popular. It's in TikTok videos, and it's Ozempic, which many of you all know about. It's soaking rolled oats overnight and then adding some lime and a cup of water and then blending it and drinking it as a smoothie, or draining the water and just drinking it, sipping it all day. So, but it's not what you see here. This is overnight oats soaked in almond milk and with granola and some berries and peach and all that. But the avena sativa, that is the oats, is the Ozempic is slightly different. So oats is going to be the first area we're going to look at. And so there were 2 studies that I looked at, and I just realized when I didn't save the actual information for the first study, which was looking at type 2 diabetes and weight. The second study was type 1 diabetes. So, so I'm just going to sort of tell you and not really be able to show the slides. But this was a study looking at patients. I think there were about 30 patients for 12 weeks with history, 37 patients with type 2 diabetes. And they were looking at either beta-glucan, which is not Ozempic, oats, the product in oats that is beta-glucan, or about 5 grams per day, which is microcrystalline cellulose, and just regular usual lifestyle. And then they looked at outcomes such as GLP-1 levels, PYI, caloric intake, A1C, HOMA, lipid profile, intestinal gut microbiota. And like I mentioned, they needed to just do 12 weeks or less. And A1C, they did show significant difference. And again, I'm sorry, I don't have it, with significant p-value in A1C, insulin, C-peptide, HOMA, and also the gut microbiome. There were significant differences, but not so significant with GLP-1 or leptin area. So they concluded that the intake of 5 grams of glucagon can help improve glucose control and also improve feeling of satiety, which is what many times Ozempic does, and also improve the gut microbiota profile. So the beta-glucan, which is the product in oats, has known hypoglycemic properties, prebiotic properties, antioxidants, cholesterol lowering, anti-tumor, which we are not going to address that, and immunomodulatory properties. It is based on animal studies or basic science studies. It does increases viscosity when consumed. So it certainly slows down your gastric emptying and so increases satiety. And also there is some change with the modulation of GLP-1 and PYI, like I mentioned earlier. There was a very interesting type 1 study, which I thought was more interesting because it was done in young adolescents. This was from Turkey. And this was looking at patients who were on 6 grams of oat beta-glucan. And they had for 1 week, they just monitored everyone on a healthy lifestyle. The second 2 weeks, they had one group on the oat, 6 grams per day. The type 2 study was 5 grams per day. And they had either patients who were on oats or just regular diet, but along with their type 1 pharmacotherapy. And like I mentioned, about 30 patients, 3 weeks, and they did use continuous glucose monitoring in these patients. And they did notice that there was quite a big impact on A1C area under the curve, and also satiety improved in these patients. And there was some changes. Weight did not change much because it was just a 3-week study, but insulin requirement did decrease. So they did notice these. And then there was one more study, which was an animal study, animal model mice study, looking at gut microbiome modulation by oat beta glucan to prevent NAFL progression. And this was a very interesting study because it looked at inflammation, fibrosis of the liver, and also looked at gut microbiome. And it did show that when you added gut micro oats to the Western style diet, or in lieu of the Western style diet, there was toll-like receptor activation and decreased macrophage infiltration, decreased hepatic fibrosis, and also improved prebiotic effect. Certain favorable gut microbiome like Lactobacillus, Ruminococcaceae, and Lactospiraceae did improve. And there was no change in weight in these mice after a few weeks, but there was certainly change in HOMA and insulinogenic index. This was a German study, and I thought it was very interesting, just published about 2 months ago. And changes with bacterial translocation, fibroinflammatory pathways. So that is oats for you guys. So those of you who already take oats every day for breakfast, you're in good shape. So the next study is berberine, because I have several patients who take berberine and some other products mixed with it. I don't know how many of you all are familiar with Golo. I have a few patients who paid $300 and got a bottle of Golo, Golo, and you will get asked about that with patients whose insurance don't cover GLP-1. And Golo's main product is berberine, along with some banaba and some other ingredients. So berberine is, they call it the nature's Ozempic, but it is not. We all know that. So there were some studies, actually several studies, looking at diabetes, prediabetes, metabolic syndrome with berberine. So berberine is isoquinoline alkaloid. It is extracted from several plant families and also some berries. Some of them are tongue twisters, so I'm going to skip reading every one of these. But certainly, there's a lot of them available here. But the biggest problem with berberine is not how effective it is, it's bioavailability. So when you take oral berberine as just a regular product, it gets disintegrated right away. And then 90% of it is also excreted in the bile. So it's broken down by glycoprotein, and you don't have much available. So that's where these supplement or a nutraceutical industry has put in a lot of effort into preparing those products in a form where they won't get disintegrated so quickly. So berberine has a lot, like I mentioned, very known a lot of function, increased insulin sensitivity and improvement in the pancreatic beta cell function. And by repairing the exhausted islets, I don't know what Dr. Mokshikanand thinks about that. So the decrease in intestinal glucose absorption by inhibition of alpha amylase and alpha glucosidase activity, then stimulation of glucose uptake through glycolysis, mitochondrial function by inhibiting the mitochondrial function. And also there is some AMPK impairment pathway here. The inhibition of hepatic gluconeogenesis also happens here, this has been generated by ATP depletion, and also it causes mitochondrial suppression in the liver. So it's a pretty complex impact on the liver, on the pancreas, and the beta cells, and also in the peripheral insulin resistance. So the summary of trials, actually, there are 3 slides long. There are several trials here. And the trials, they talk about the type 2 diabetes, subjects, hypercholesterolemia, obesity, and also some other patients, which will come in the next slide. So they look at parameters such as fasting plasma glucose, postprandial glucose, A1C, and HOMA-IR. And many of these studies did show a significant impact or change in them. But like I mentioned earlier, many of them are done for short term, few weeks, and the age groups are very different for each of them. And also the doses used are very different. That's always a problem with the dietary supplement studies, is the dosing. So when they do administer this, they do modulate the P glycoprotein activity. And so this is one of the common products is the Silimarine or Silibium marinium, which is the best candidate because it does help with a good safety. It does have a good safety profile also. The other studies looked at cardiovascular risk syndromes, metabolic syndrome, and also pre-diabetic patients, impaired fasting glucose. And there was one study comparing, which I forgot to mention, comparing berberine with metformin, and another one comparing berberine with other oral hypoglycemic agents. And it did show some comparative improvement in those markers that we show interest in with the glucose metrics. So what about cardiovascular studies? And this was a very nice review looking at different impact, triglycerides, LDL, HDL, fasting blood glucose, insulin. And there were limitations in many of the studies, inconsistent studies. And there was some publication bias and study biases, and quality of evidence was not great. But some of them did show some changes. As you can see here, quality of evidence wasn't great. There was one looking at weight, and that had modest quality of evidence. But then certainly, the risk bias was there. So they're not perfect, but it is available. Waist circumference, again, low evidence, and ALT, AST, again, low evidence. So not a whole lot. And so with this systematic review and meta-analysis, the authors concluded that there is significant improvement in lipid profiles, insulin resistance, anthropometric measurements, and that's why it's so popular among the patients who try to take it for weight management, but no changes with inflammation or liver enzymes. So it may be an effective supplement, but not a treatment as such. So we do need much more longitudinal mechanistic sort of studies, more homogeneous RCTs rather than very heterogeneous studies that we see here. The other product that we look at is Banaba, which again, with the GOLO, they have the berberine and the Banaba. So, and this is another interesting sort of product. It's Legostromia species, and I don't know how many here do understand much of this sort of plant taxonomy names, but certainly some of them are tongue twisters. It does enhance, it has a very interesting activity. It's PPAR-like activity. So it does cause enhancement of cellular glucose uptake and reduction in sucrose and starch hydrolysis. It decreases gluconeogenesis, and also it does increase glycolysis by raising the glucokinase activity. And like I mentioned earlier, the liver peroxisome proliferator activated receptor, PPAR alpha activity, mRNA is activated, and also PPAR gamma, and also inhibition of alpha glucosidase activity, which we have Acarbose available, but this Banaba has a similar sort of impact also. And there are studies for Banaba also looking at, and again, some of them have 10 milligrams, some have 48 milligrams per day. So the dosages vary a lot. Some were like 2 grams of soybean leaf extract for 12 weeks. We don't know the actual content. And one was a 6-gram study. The other one was 310 with berberine, Banaba, and curcumin, which we'll talk about in a minute. And so it was a combination of several products. So we don't know if the impact was really with Banaba or was it something else, some other product in it. So No clear clinical studies, so it's hard to make a case there. Curcumin, which has been studied a lot, the turmeric that we all know it as, in several areas, cancer, immunity, antioxidant, diabetes, weight, and lipid area. So it has got multiple sort of roles that is being looked at. This again, similar to the Banaba, it's got a PPAR gamma activation, similar to TZD in a way. So, and I wasn't aware of that, Dr. Mokshikanam, before I read this. So, and it does cause inhibition of gluconeogenesis and increase in glucose uptake. And it also acts on the pancreatic beta cells and increases the antioxidant status. And it does also have other impacts, such as it's mediated by lipid peroxidation and IL-6, TNF alpha, and it does improve inflammatory markers such as the IL-6 and all of those. And then it also inhibits liver glucose production by activation of the AMP kinase pathway and inhibition of the G6P. So, so it does have very many complex roles. And certainly there have been several studies. And like I mentioned earlier, the dosing, the duration is all variable. And many did not show very much impact in blood glucose, but some did show that the HOMA-IR did improve and the A1C did improve. And again, this herb was combined with some other dietary supplements, and that showed very lot of effects. So we do not know if it was confounding or was independent. And it has been looked at dyslipidemia, overweight, and also at non-diabetic proteinuria, CKD, metabolic syndrome. Now, I'm not talking about the cancer area because at least I have one or two patients who take super turmeric for their cancer and based on recommendation by their oncologist. So guar gum is another area which does have similar activity by stimulating GLP-1 secretion, peripheral improving glucose clearance, hepatic insulin extraction, and decreasing insulin release, and also small bowel postprandial glucose absorption in a way, and delaying gastric emptying because of its consistency. Stevia, which is already in the market and is available and as a alternate to blood sugar to sugar, is very well known already, and it's a supplement available everywhere. And it has a few studies too, and it has shown to improve insulin secretion, decreased gluconeogenesis, and works through the P13 AKT pathway and GLUT4 translocation. So that is stevia. And there are several studies on stevia also. Lean and obese subjects, type 2 diabetes volunteers, and pre-diabetic patients. And some did show some improvement with the postprandial blood sugars and postprandial insulin levels, and some did not show that similar effect. So some other nutraceuticals in this area of diabetes metabolic syndrome will be psyllium, mulberry leaves, quercetin, omega, which we are all familiar with, omega fatty acids. But those are some of the dietary supplements that have been studied here. So that sort of is the diabetes obesity area. And berberine, we did see some effect, turmeric some, and Banaba some, but some of the others not so sure. Gum, we already know guar gum is in the obesity sort of in the pathway, so it has been used, and psyllium also. Thyroid, interestingly, the recommendation is, as of now, there's really nothing available. The studies have looked at carnitine, inositols, melatonin, resveratrol, selenium. Just very recently, there was a selenium study, but selenium has been studied in several areas in thyroid, in hyperthyroidism, hypothyroidism, pregnant hypothyroid patients, thyroid eye disease. So in the setting of hypothyroidism, there may be some benefit with the antibodies. There's been 1 or 2 studies looking at it. But I think it was an Italian study. But otherwise, there's not very strong areas for selenium. But among the supplements in thyroid, selenium is one that's been more often studied, and you have much better studies. What about adrenal health or pituitary adrenal axis health overall? These nutritional products or dietary supplements are known as adaptogens. And again, there's not very clear guidelines or recommendations for these, but as I've listed here, there's a long list of these, and many of them are roots, valerinia, which many of you all may be familiar with, passiflora, kava, Kava, plant sterols, which many times we see that in among athletes being abused because it's not detected in screening. So plant sterols are used for improving performance. So that is one area that in steroids in the endocrinology area, which is in performance enhancing androgens or steroids. There is a lot of these dietary supplements, and many of them are sold in the gray market, and some of them have been banned in sports and competitive events. So that is a different area that by itself is a talk. But there are some neurotransmitter precursors, which many of my patients actually buy online, L-theanine, GABA, and L-tryptophan. Some of them do take it, 5-MTHF, lycopene. I have a patient who has a long list and has been religiously taking that for several years, and nothing will stop him from taking it. So, so those are some of the things. And then fenugreek compounds. And I did not know that fenugreek was so popular until 10 years ago when I have a patient who has low testosterone, but has contraindications to treatment. It's functional hypogonadism. And he said, here, I found fenugreek. It does help. And he pays and takes fenugreek. So I haven't found much difference, but he says he feels better with all the symptoms that he has. Fenugreek has a long list of effects: hypoglycemia, anti-hypolipidemic, antioxidative, anti-inflammatory, atherogenic, hypertensive, carcinogenic, immunomodulatory, and anti-nociceptive, with potential organ protection, just like they advertise organ protection, but not necessarily health impact. Certain inflammatory conditions, it has been used. And I forgot to mention turmeric is used for infection also, for skin infections and such, and dysfunctions in the reproductive system. I couldn't find any very good studies, but I did find this very nice, complicated slide looking at the various mechanisms or presumed mechanisms of fenugreek chemicals against many chronic diseases: blood glucose, insulin sensitivity, diabetes, and the things that we listed earlier, and how it does it, like cell cycle, DNA repair, apoptosis, protein synthesis, serotoninogenic system, inflammation, nuclear translocation are some of the areas. So it is a very interesting area, and it also has some impact in angiotensin 1 and 2, so blood pressure, those areas, and lipids. Well, the biggest question is, what is the dose, therapeutic dose? What is the toxic dose? We do not have any good RCTs, so I don't have much answers for that. So anti-aging, let's see how much time we have here. So many times, many of my patients want to have good skin elasticity, like skin as they age, it's getting older. No, I need better skin. So many of them go to the drugstore, buy collagen, put it in their coffee, and drink it every day. So I always wondered if it has any effect. And the collagen they get could be sometimes from marine source, sometimes it can be bovine, and sometimes it can be somewhere else. I don't know where. Maybe birds, I think. No, not birds, mammals. So, but I have not found much data. So I went and sort of tried digging in to see what this exogenous collagen that people are taking, if it has any impact. Well, there's a list of potential impacts: rheumatoid arthritis, regeneration, osteoporosis, which we don't have studies on that, by the way, bone regeneration, and psoriatic arthritis, bone effects, sarcopenia, and GERD, and also periodontitis, skin aging, and diabetes and osteoporosis. So some of the comorbidities that it treats. The collagen sources, I didn't realize there was a separate journal in PubMed dedicated to marine drug origins, and I did not know that. And I think it's a Japanese journal, but it is in PubMed. So, and they had very interesting articles on marine collagen, or collagen with the source from the sponge, fish, jellyfish, or anything which you get from the ocean. And they compared studies looking at collagen from fish versus collagen from the land. And some of their impact or outcomes were better when they used the sea or the oceanic collagen for osteoporosis, wound healing, and osteoarthritis. Interestingly, these are, again, not very many studies, not very many articles, but this was one from Japan, looking at, I think, 12 adults and comparing with the placebo and marine origin collagen, and looking at elasticity, IGF-1 levels, and number of pores. And they were able to show that there was improvement in skin elasticity and decrease in number of pores. And I think a slight change that I didn't put that slide in because of time, in IGF-1 levels. Just after 12 weeks of it, like I mentioned, it's East Asian. I said 12, actually it was 22 healthy participants. And from baseline to, so, and then there's one other study, again, a lot of meta-analysis and systematic reviews, looking at hydrolyzed collagen on skin aging. And there were several hundreds of studies. They eliminated most of them based on bias and everything. And then they finally came up with a few studies. And the author did say in the end that there probably is a benefit for 90 days of collagen in skin aging, and it does reduce wrinkles and improves elasticity and hydration. But then in the following edition of the journal, International Journal of Dermatology, there was a rebuttal to this from a different group saying how flawed the actual meta-analysis was, and the studies that had to be removed were not removed. So actually, unless you have some longitudinal studies, you cannot really come up with a good sort of response, because they're widely heterogeneous. Sample size was different and very low. Doses were different. There were a lot of dropouts. Funding sources were questionable. They were funded by the companies. Duration was limited. Age groups are different. If you bring a young person and measure their elasticity, it's going to be, and skin sites where they were measured. So this rebuttal had a better looking sort of a graph and said it's low quality and you need large sample studies, double-blinded RCTs with using histological outcomes, not just measurement or perception of the patient, to establish hydrolyzed collagen on skin aging. So that's about collagen, which I can at least tell my patients about it. So, and if they really insist on it, I'll tell them marine collagen, as long as they don't have allergies or reactions to it. So what about aging and muscle and skeleton and cognitive function? It's fine print, but you don't need to, because this is the listed products, some products being sold in stores for aging that seem to at least talk about improving these three areas: skeletal, muscle, and cognition. Well, based on another meta-analysis, what has been reviewed and substantiated are just these products here, which this one here covers all three areas, and this list here is any one of the three areas, not all the areas. I found creatine in both of them, which I tell my patients do not do creatine, but it is here. Calcium, we all know, magnesium, omega-3 fatty acids, omega-3 fatty acids, potassium, which if the potassium is fine, they shouldn't. This is more dietary. So it's more for people who are doing canned foods, those kind of things. B6, B9, B12, vitamin C, D, E, and K2, and zinc. And K, again, those who are on blood thinners or have issues with bleeding shouldn't be on it. And zinc is also in there. So that's that area. So in summary, it's a quite unregulated billion-dollar industry. I didn't have time to go into details of every study, and definitely we need a lot more large longitudinal, well assigned RCTs. And we are seeing a lot more so post-pandemic. Just the other day, I don't know who was the fellow with me. We had a patient in VA who came and said when he has a cold, he goes out there to the garden and pulls dandelion and chews on it. Or when he has a skin rash, or I don't know if it's the other way, his wife boils the willow bark and then he drinks the tea. And so that's how he lives his life. And he travels to Vietnam just to study the herbs and everything. But at the same time, he takes testosterone. So, but anyway, so some certain nutraceuticals, such as the berberine, banaba, curcumin, guar gum, showed some impact. Again, the studies are short-term studies, so we don't have very much information, but it did have some favorable glucose profile and perhaps some weight benefit, and could be used. We could be further studied, and there some of the argument of the failed trials maybe because the preparation wasn't optimal, and that again is a challenge in these areas. So some research here, which I only know of these, and I know there are probably many others. Dr. Kling may know a lot more. I know Dr. Kakar studied ashwagandha, and I remember when I was a fellow, sometime he talked about it. Shahid Baba is studying carnosine and actually has been approved with the NIH grant to do a bedside study. And of course, the microbiota area, which is widely studied in gastroenterology and the liver area, and also we in endocrine, and also I think Dr. Budluri studies a lot of nutrition and plant-based also. I'm sure there's several other areas here, and there are several potential areas to look at. And again, like I said, it is what is limiting us is how we go about doing it, who funds it, and what are the preparations. Looking at health promotion, disease prevention, as we all move away from the pandemic. So I wanted to stop here and take any questions, and the event code is right there. I don't know how many of you all watched the women's NCAA last month. It was one of the best games I've ever watched. And Caitlin Clark, who's my favorite, Iowa 22, her jersey has been retired. She's with Indiana now, Indiana Fevers. And I heard they already have requested that the game between the Chicago Skies and for the Fever, they didn't want to do it in the usual arena. They're going to use the United Center, which they used to use for the Chicago Bulls. So to me, that's a very proud women for the women's sports event. So thank you all, and happy to take any questions. Actually, I end the slideshow first, right?
Yeah,
And
not the slideshows.
oh, yeah. Oh,
Yeah, it seems to me that if it's under-regulated, and I'm not sure what the regulation is, then even if one does a study that shows something has a positive effect,
mm-hmm.
then it could be somebody else's preparation would be different,
Mm-hmm.
you know? So
Yes.
even, you know, unless it's well-regulated, like pharmaceuticals.
Yes. Yes.
Uh,
It's grossly
wishy-washy.
under-regulated. Yes, very wishy-washy. You're right. Yeah. There are very few good studies I saw, but then these are small groups. And the way, like I showed how FDA has a pipeline for our prescription drugs. For instance, for the GLP-1, we did a phase 3 and it took 10 years. 2010 was the first time I did it. It took 10 years to get it approved for the cardiovascular or, to get the weight. So it takes so much more studies, very expensive. to do all those. And,
So the thing is,
Mhm.
when you're dealing with nutraceuticals or supplements, you don't have a specific claim that you can do a specific disease.
That's right.
It's a very broad term that they,
That's true.
so that's why they can get away with it. And
That's right.
in terms of the, whether we can get the same product or not, that always has been a problem.
Mhm. Mhm.
Even like, with, my conflict of interest on this one, we do have
Mhm.
in India, we do, from my grandfather's time,
Mhm.
100 years, we have a Ayurvedic company. So we make all these
Yes.
things. And curcumin, for example,
Mhm.
so it depends on where you buy the turmeric
Okay. The source of the turmeric.
source,
Mhm.
because the quality there depends on the soil in which it is grown and all of those things.
Mhm.
So it actually varies from place to place.
Land to land,
How
region
it
to
was
region.
grown.
Yeah.
It's just like making wine and, you just take,
Mhm.
right.
But even like with diroxin, when when the preparations were by the
Mhm.
main brand
Yes.
or by the
Mhm.
generic, and there was a big question. all
That's
the
right.
time.
That's right.
But here, you really get it.
Yes. Yeah. And
Yeah, and we do have, like, I even have at home, I have ashwagandha
Mhm.
cookies.
Mhm. I see Dr. Thakur is on the screen.
Jeera,
Yeah. Mhm.
jeera and,
Mhm. Ghee. Mhm.
jeera and
Mhm.
ginger
Okay.
cookie,
Mhm.
brahmi cookies.
Oh,
you know.
okay.
So, because
Dr.
now,
Mokshigandam is talking
because
about
it-
Ayurvedic cookies.
yeah, I mean, because it's become more popular, this is,
Mhm.
because in the past, they were all
Mhm.
drugs. in the sense
That's
they were
right.
Classical, so if you have to sell an Ayurvedic drug
Yes.
as an Ayurvedic drug,
Mhm.
then what happens is that you have to go and
Mhm.
refer to the original Ayurvedic text
Mhm.
where this was described,
Yes.
okay?
Mhm.
And then your preparation has to conform to what that book said.
Okay. Mhm.
Whereas if you want to make a
Supplement.
supplement, you
It's-
don't.
Yes.
It's
Yes.
actually easier to do.
Yeah, it's easier to do it, yeah. And most of the studies that I got were actually from international sort of Asia, like India, Pakistan, Turkey, Italy, Germany, and many other, China, a lot of publication, but we really don't have a very controlled, but then patients are buying it. They're buying and then we are treating them. So what works, what doesn't is a problem. So, yeah. So, there's Dr. Winters just mentioned that Dr. Clark did publish on DHEA. Actually, I didn't get time to go into women's reproduction, but I'll certainly look into it. Um, Dr. Thakur, did you have a question? Did you raise your hand?
Yeah, this is a new study we perform. I'm working on ashwagandha, specifically the compound called vidafirin A, which is the most biological active compound in ashwagandha. So we not only saw that it has an anti-cancer property and target cancer stem cell, but it has an anti-cachectic property. So in
Okay.
cancer patient, one of the major effect of cancer is to weakening of the muscle and the loss of muscle,
Mm-hmm.
and
Mhm.
also the cardiac dysfunction, which lead
Mhm.
to heart attack. So we saw beneficial effect, and I'm just revising the paper for submission for tomorrow,
Awesome.
which
Mhm.
looks the effect on cardiac function. We have one
Yes.
paper, and also to add that to go further, we are doing clinical trial of ashwagandha in combination with Doxil. Doxil is a second line chemotherapy for ovarian recurrent cancer,
Mhm.
which is
Mhm.
approved by FDA, and we are in the process of recruiting the patient.
Okay,
So I think we'll see what the outcome is, but it
that's
looks
very
like
good to know.
promising.
That's good to know. Thank you. Thank you for sharing that information and thank you for coming to the talk.
Sure,
Um,
thank you.
So,
Thank you. You provided a lot of information. This is,
well, I
as
couldn't cover everything, and I see one of the guests, Dr. Kulkarni, mentioned inositol, which I meant to do female reproduction because when I talk about PCOS, we do, I have a few patients who take inositol. At the same time, one of our experts from the REI area who traveled from LA and came here, he said he has a big expertise in PCOS, and he mentioned he didn't find any difference, but I have patients who do take inositol, and yes, in PCOS, we do have some studies on that. And there is another comment from Dr. Cotwall. He says one of the sources of antiviral polyphenols is pomegranate juice, which is a broad spectrum antiviral activity and developed as enveloped virus neutralizing compounds. And our studies showed that in vitro, 50 microliters of palm juice can neutralize 1 million viral particles, including HIV, influenza, SARS, herpes. And they don't have to be in a capsule form. We just need to have not been studied yet. Yeah, thank you for that comment, and thank you for being here. And Dr. Clark's DHEAS, I'll certainly read. As I was making these slides and I looked at the time, I realized I couldn't cover male-female reproduction because by itself, it's a big area. And there's been a lot of studies there, and plus also the adrenal area also. So thank you everyone for being here. And if you have any other questions, do email me directly. And thanks everyone for being here.